Hi, I'm Dr. Karen Roberts. One of the most exciting things to happen in the last 10 years for me was starting to learn robotic surgery. I first started doing it because it allowed for patients to have less pain and a quicker recovery, but it's been remarkable of how it allowed for some women who otherwise couldn't or wouldn't want surgery to allow them to get the surgery they needed with less pain and less time off of work. What makes robotic surgery unique is that it uses laparoscopic instrumentation, but it allows the instruments to work more like hands internally. So through tiny incisions, the size of a buttonhole, we're able to do surgeries that are very complex and sometimes even better than if we did them with an open incision because of the camera that has the 3D aspects, and certainly less inflammation because we're cutting less, therefore the patient is more comfortable. Most people having robotic non-hysterectomies go home the same day, and the hysterectomy patients almost always go home the next day. There is still all the risks of any surgery, of course, but the faster recovery and the more comfortable recovery has made it an acceptable option for patients who have no other choice than some kind of surgery. Almost every woman planning a hysterectomy is a potential candidate, and a lot of the patients that need either diagnostic laparoscopy to look for endometriosis or perhaps ovarian surgeries work as well. Sometimes patients can have very large uteruses, and that may make it necessary for us to make an incision, but the vast majority of patients who come to me to try to have a robotic hysterectomy, I've been able to do successfully. My last patient was about half a kilo worth of tissue. It did take a while, but she was able to go home the next morning with minimal pain medication. Insurance coverage is usually quite good. In fact, I've never had a patient that was forced to have an abdominal surgery that was a candidate for a robotic surgery. All robotic patients do need to be prepared that we may not be able to do it robotically safely. The person who is most likely to be converted into an open surgery is a person who has scarring, most often from other surgeries, most often from bowel surgeries. Patients who've had prior cesareans are actually perfect candidates for this because we can see the scarring much better than we could with a open surgery or a vaginal hysterectomy.